Okay, so the purpose of our study was to assess the effect of chewing 4 to 6 milligrams of caffeine per kilogram containing gum on physiological response and volitional running time to fatigue in recreational runners. We found that there's a lack of evidence and research on using running as a primary exercise mode or gum as the caffeine source. So we investigated the impact of consumption on caffeinated gum on endurance running performance in healthy adults by collecting both qualitative and quantitative data. The participants were subjects that were healthy adults who self-reported regular running exercise activity at least for 30 minutes, conducted at least 3 times a week for the last 6 months. And subjects also reported being typical consumers of caffeinated products with excellent physical and mental health.
Our study recruited 8 healthy recreational runners from the Findlay and BG area, and they consented to participate in 3 days of testing, with each session being approximately 1 hour. The first session, we performed a VO2 max test on a treadmill at an increasing grade. On the second day of testing, we had participants run 30 minutes on a treadmill at 70% of their calculated VO2 max, and then had them increase to 90% of VO2 max and instructed to run to volitional fatigue. At the 10-minute mark into the trial, subjects were given gum containing either caffeine or the placebo, consistent with the 4 milligrams per kilogram of body weight, and that administration was double blind. During the trials, we collected data on oxygen uptake, RER, minute ventilation, respiratory rate, heart rate, blood pressure, RPE, and then that exercise performance time. We also had blood lactate levels at before, during, and at the 10-minute mark. Dietary logs were also monitored prior to the sessions as well. And participants returned 5 to 10 days later to repeat the same process with the other gum they had not previously received, to allow for comparison of time to volitional fatigue.
Taking a quick glance at the data, we did not find anything significant with RER or fat carb utilization ratio, due to the fact that any data points that had a p-value of less than 0.05 was also significant during the first 10 minutes of the run, which is before any interventions began. No significant difference in running performance to volitional fatigue either. However, we did find that METs and VO2 were almost significant after running for 30 minutes at 70% of VO2. These findings are not consistent with previous literature due to the number of limitations in our study, such as a small sample size, which was a result of COVID restrictions. Performing a similar study with a larger sample size would be warranted.